You walk into the doctor's office and you look at the clock. The receptionist asks you, what time is your appointment? You respond. She asks to see your insurance card, and then she hands you a clipboard with forms, highlighted to sign your name. You don't have the time to read through all the information, so you sign your name in the highlighted areas. You sign the forms and you feel like you signed your life away. It has the same effect when you are reading the Apple policy or when you are trying to sift through all the information when you're buying a house. You take a seat and you wait to be called. The nurse steps out from behind the door and says, Mrs. X, you can come with me. She takes you over to the scale. Now you realize you weigh more than you expected. Your body mass index is under scrutiny, and once you walk down the corridor, your blood pressure will be taken before you visit the doctor. Your blood pressure has shot up to the ceiling because you just learned you are overweight, and you will be thrown into a category of obesity. Nurse Betty takes your blood pressure, and it is 180 over 120. You are staring into the face of high blood pressure and diabetes. In comes the doctors to review the results. The doctor takes your blood pressure again to check against the nurse results. Here we go. Order of lab work, medication out the wazoo, your next appointment date. Not once did the doctor ask you if you were stressed out about any life crisis. Not once did the doctor ask you, were you nervous about today's appointment. Not once did the doctor offer any information on how to improve your health through a nutritional diet. Instead, their gold standard procedure, which is aggressive drug treatment and aggressive surgery, was presented. The doctor did not offer these services because once he stepped out of medical school, he was trained not in nutritional health. The doctor was trained in pill and aggressive treatment and to keep you as a permanent patient for the rest of the patient's life. The insurance denies the medication, forcing patients to take a less expensive drug or a generic. The question in my mind, if the high-cost drug didn't work and there have been no further studies to improve the drug, now listen closely. The drug has increased in value, but it has no value to the patient because the drug doesn't work. The pharmaceutical becomes the head doctor in charge. The drugs that were taken in, let's say in the 80s, have increased 500%, being a detriment to the patient's health. Your doctor becomes under pressure and is at the mercy of the pharmaceutical company to get the patients to take the statins, the high blood pressure medicine, the diabetic medicine that does not work. Not once has the doctor, the pharmaceutical company, or the insurance companies offered a nutritional solution for your health. Not one carrot, not one bean, not one kiwi, no nutritional food. Is there a doctor in the house? On the way to the lab, you're thinking, did the doctor even notice my race? African Americans, Latinos, Asians, and Native Americans are at higher risk for certain diseases due to socioeconomical income, based on one's education, job, and income, which can put you in a lower income bracket. The person or the patient does not receive the same opportunities to get the appropriate health care services. The person or patient is at a much higher risk to be in poor health and have chronic conditions and disabilities. As you wait to have your blood pressure rechecked again, because you ask, it can't be that high. And the doctor looks at you, he says, I'll have the nurse draw your blood. And while you're sitting in the chair, you're thinking, not once did the doctor ask me, had I witnessed any violent crimes, any carjacking, police shootings, robbery, where someone got shot, a murder. Not once did the doctor ask me, have you seen anyone assaulted with a deadly weapon? Did you witness any domestic violence? As you get up from that chair after getting your blood drawn, you're sitting there thinking, you have seen more bloodshed in 1 week than the lab could test in 1 year. You live in that neighborhood that all these events take place. It not only impacts your health, but your mental health, your spiritual health, your emotional health, and financial health. You cannot do anything about your race, which increases your chance of getting certain diseases. The doctor don't seem to connect the dots. You will hear the old adage, do the best you can with what you got. You don't have anything. You're poor. And you don't feel like you can stand up to the doctors because you're not intelligent enough. Yet these Western medical doctors and other healthcare providers, pharmacists, therapists, nurses, treat symptoms and diseases using drugs, radiation, or surgery. They are not patient-focused. Western medicines get rapid or immediate results when it comes to life-threatening conditions such as infectious disease. Don't treat the patient like they are infectious diseases, killing the healthy cells in their body using chemo and radiation. Eastern medicine focuses on the patient and the underlying cause of the problem. What you want to say to a doctor, no matter what your socioeconomic status, is to ask the doctor, what is the cause of the problem? And can this problem be corrected through changing my diet? When you hear the word idiopathic, it means of unknown cause. Well, if the disease is unknown, why do I need medication or surgery? Are you treating the symptoms? You just said the cause was unknown. Is there a doctor in the house? Many doctors left their practices to help more patients manage their health instead of the medical industry put patients on a permanent weasel wheel of life-threatening drugs and surgery. Another old adage is, everything that glitters is not gold. Absolutely. The gold standard of medicine is not etched in stone. Treatment should not be one-sided for a patient through just biopsies, images, blood work, or always trying to evaluate the effectiveness of a drug. What about making nutritional health the gold standard? Is it possible to reassure a patient there is hope and the doctor is willing to communicate in such a way that he's doing everything he can to work in the best interest of the patient and not put profit before his patients? Is there a doctor in the house? A doctor that will break down and explain that disease is a malfunction of cells. A doctor that explains to the patient it is deficiency of nutrients and toxicity in one's environment. If a patient is given a placebo and that helps with the improvement of their disease, meditation, prayer, support of family, exercise, friends, the support of your doctor that can view the patient as a whole person and not as thousands of cells is the perfect prescription to heal a patient. At the end of the day, the patient don't feel as though they are abandoned by the medical profession and isolated. This type of treatment by Western medicine is recognized by the patient as the gold standard. As the patient takes a closer look, they want more for their life and health care. The question is asked by the patient, is there a doctor in the house?